So I wanted to talk a little bit, go into a little more detail about lab testing for this year. So first of all, I want to talk about COVID testing and I think you all know this at this point, but just to emphasize that you really want to be using a PCR test for your COVID-19 testing of symptomatic residents. You don't want to use the rapid antigen testing for that. PCR tests are substantially more sensitive than the rapid antigen test. So the PCR test is a molecular test, so it actually finds a piece of the genetic material of the virus, of the RNA actually. Um, and so that's what helps make it so much more sensitive. Um, and as you know, only certain groups are eligible in the province for PCR testing, but your residents in long-term care homes are definitely one of those people who are eligible, as well as your staff and volunteers. Um, and households, members of staff who work at these highest risk settings are eligible as well. And just the rat test, the problem with them is a single negative test really doesn't rule out COVID in somebody with COVID symptoms. Um, it does help if for some reason you can't obtain PCR testing and you are going to rely on a rat test, then you need to know that a single negative test doesn't rule out COVID. You'll need to do two rat tests separated by at least 24 to 48 hours. And if they're both negative, then you can say with higher certainty that the person doesn't have COVID. Although really, it really is that PCR test that you need to be sure about that. I just wanted to mention that at the beginning. So we are talking about how we're looking at flu and other viruses coming along this year. So the testing that's available is the multiplex respiratory virus PCR testing. So and we'll talk about what you need to choose on the lab requisition to get the right testing. But when you choose the right thing, which is respiratory viruses and COVID-19, that one swab will then be tested in the lab for all of these viruses. So the influenza A's, influenza B, your RSV, parainfluenza, adenovirus, enterovirus, your seasonal human coronaviruses, which you might remember from pre-COVID, we had those circulating, rhinovirus, human metapneumovirus, and of course COVID-19. Now the lab, there is testing eligibility. It's not just anybody in the province can get one of these MRVP tests. So I've put in bold the ones that are most significant to you, which is that people in institutional settings that are not in outbreak, who are symptomatic, can have one of these tests. And then people in outbreak investigations in one of these highest risk settings on the direction of public health. So that would include symptomatic residents, staff, and/or essential visitors in an institutional or congregate living setting who have acute respiratory illness. The key there, though, is that there's a maximum of 4 swabs that will be allowed per outbreak. So that is something to keep in mind. For COVID, it will be continuing to test anybody who is symptomatic in these highest risk settings for COVID, but to get the full panel of MRVP, that's a maximum of 4 swabs. So you might have used some of this in your facility, that there are alternatives to a nasopharyngeal swab. However, I just want to emphasize that the NP swab is really, again, your best choice, while these other methods have proven to be acceptable and find the virus. The NP swab is the gold standard. But if you are using any of these alternatives to a nasopharyngeal swab, just make sure that the kit that you're using supports that alternative swab technique. And you also want to ensure that the kit that you're using supports testing for COVID, for the MRVP, and for rapid flu testing. And that is not something I would have had to say in previous years. But when the pandemic came along, there was a lot of additions to the regular respiratory swab kits that we were used to. And when I look on Public Health Ontario's lab site website, they're showing up to 43 different kits. Now, all of those are not being sent to long-term care for sure, but there could be ones that are different from what you had in the past. So you just want to make sure that the kit that you have um, meets your needs. And you can do that. You can connect with us, or you can call the lab directly and they will assist with you. And I didn't put, one of the alternatives that came out during COVID was saliva only. And I just want to mention that saliva only can be only used to test for COVID-19. You can't use just saliva to test for the MRVP. So lab requisitions, these are really important. And like it was mentioned in the Public Health Ontario session, you want to be well prepared with these. You want to know which requisition you're to use, where they are, and all the staff who may need them, including or need to use them, including staff on evenings and weekends, know where they are. So the lab requisition is available online at the PHO site. It's fillable online, I do believe, but then it must be printed and sent with your specimen bag. In some cases, you will have these already printed and already in kits, and that's fine too. But you want to make sure that you have the right requisition, and it is the COVID-19 and respiratory virus test requisition that you'll use for respiratory testing this season, as opposed to the general test requisition. So you want to make sure you have that one. And what the arrow shows here is the importance of filling out the outbreak number. If this is part of a suspect or confirmed outbreak investigation, it's critical that you put that number on there so that everything can be linked up and we can more easily find your lab results later. The other part I wanted to highlight on this requisition, it's critical that you pick what test is required, and you need to only mark one of these three. So your choices is COVID-19 or respiratory viruses, or COVID-19 and respiratory viruses. So for the most part, you're going to be picking that third one, COVID-19 and respiratory viruses. There may be some instances where you're just picking COVID-19 because, as I mentioned, all symptomatic residents will continue to be tested for COVID. Also important to make sure you check off the patient setting and type. This is because the lab restricts what testing they will do for what groups. It's really important that this is checked off appropriately, and there is a section there for institutions, which is what you would check off, as well as write the name of your institution in that box. So let's look at a scenario. If you have one unwell resident, you're so unwell with respiratory symptoms, you're going to do a nasopharyngeal swab. You're going to check off that test for COVID and respiratory viruses. And if they were to come back negative for all of that, and you only have this one person with symptoms in your facility, you're going to keep that person isolated on the proper precautions until they have no fever and their symptoms are improving for at least 24 hours. If you have the one unwell resident and you've tested them and they've come back positive for COVID, you will keep them on additional precautions, which is contact and droplet for 10 days from the onset of their symptoms. New guidance now asks that you isolate their roommate on the same precautions for a minimum of 5 days since their last exposure, and you would get a swab for them for COVID on day 5. And if it's negative, they can come out of isolation, but your sick person stays in for 10 days. If it's positive for influenza, you're going to isolate that person, that case, on contact and droplet precautions again for 5 days from the onset of symptoms. You're going to be very vigilant watching for symptoms in other residents. And this is where, as Public Health Rodora talked about, your surveillance program becomes so important so that you can find these people with symptoms. And if anybody else has symptoms, you will test them right away for the full panel. And if they come back positive for one of those other viruses we mentioned, then they isolate again on additional precautions, still contact droplet precautions, for 5 days. This may extend to 8 days if it is RSV or human metapneumovirus. And that is because there is evidence that indicates that those viruses are communicable for a longer period of time. So if you're getting into a suspect outbreak because you have more than one unwell resident, um, you want to make sure. So, like I said, everybody who's symptomatic gets tested for COVID-19, but only 4 specimens can be tested for both COVID and the MRVP. So, how do you pick those 4? You want to test the sickest residents or the most recent onset, and the best choice is residents who meet both those criteria. So that's, and you can certainly talk to one of the team here at Public Health who can assist you in deciding which residents would be most appropriate to do those 4 swabs on. And often at the beginning of an outbreak, we encourage you not to use all 4, to do 2 or 3 and hold 1 or 2 back for testing later in the outbreak, or if nothing is identified on those tests and we want to do more testing. So a little wrinkle with COVID, and you're probably all, I know you're all well aware of this at this point, but when it comes to testing, there's the little thing about people who are positive for COVID may continue to test positive on PCR after their clearance from isolation. So we know that they can test positive for up to 90 days from their original infection. So generally, it's not recommended to retest people within 90 days after a COVID case unless there's good clinical indication. And a good clinical indication is that they had recovered from their previous infection and now they have respiratory symptoms that are new again. So then it would make sense there may need to be some additional investigation with the lab. Sometimes in trying to decide if the person is a true positive. However, if they've got symptoms again, it's likely that we can trust that PCR. So I just want to mention about getting specimens to the lab. There's been a lot of changes and things over the last 2 years with COVID. So specimens, for the most part, for this season, will be tested at the Public Health Laboratory, which is the one in London on Commissioners Road East. So you'll let Southwestern Public Health know when you have a suspect outbreak. Of course, you'll get your outbreak number, and that's added to all testing requisitions. So most of you currently have couriers in place that pick up your different samples. And what I'm told is as long as you have the correct requisition, so the public health lab requisition on that bag, then that bag will get to the public health lab, even if it's a Life Labs courier or some other courier that's picking up. For samples that are collected, that need to go in after your regular courier is already gone or on weekends, or if you don't have a regular courier, be in touch with us. We will help and arrange pickup of those samples and get them to the lab. And I have asked staff who are assigned to your facilities to have some detailed conversations with you ahead of time regarding what your lab process is, just so that we're really clear and we're not in the middle of or the beginning of an outbreak and trying to decide what's happening with your lab samples. I have to mention enteric kits. Don't know what we'll see this year. Certainly, we've had previous years with lots of norovirus outbreaks during the same season. So you may have to do some testing for enteric issues. You will get kits from us. They have 2 vials. One is a green cap and one is a white cap. The green cap's for bacterial testing. The white cap is for viral testing. And that viral and Clostridium perfringens, which is a toxin, that kind of testing is not something you can get done through your normal testing that you might do at your home for bacteria and parasites. So it's important that you use the public health test kit. And this time you'll use the general test requisition, not the respiratory virus requisition, and check off the appropriate test required for enteric.